Brittany. I'm going to be your nurse today, and I'm going to be performing a postpartum assessment on you. So before we begin, let me wash my hands and put on some gloves. And what's your name and date of birth? Okay, and I'm just going to verify that with your wristband. Thank you. And I'm going to, or do you have any allergies to anything? No? And how are you feeling after having the baby? Good, great, okay. And I see that you're holding the baby with you, so if you don't mind, I'm going to take the baby and hand the baby off to Grandma so that we can perform the assessment on you. And then I'll give you baby right back, okay? Are you breastfeeding or bottle feeding? Breastfeeding, good. How's that going for you? It's going good. Do you mind if later I come in and sit in on a session of you guys breastfeeding so I can observe how the baby latches? Okay, good, thank you. Just call me the next time you're gonna feed the baby, okay? So first we're going to start off with taking your vital signs. So I'm going to take your blood pressure, and that should be within normal limits unless mom had preeclampsia or an underlying health condition. And then I'm going to assess the temperature, which should be within normal limits unless she has an infection, 98.6. And then I'm going to assess her respirations and her pulse. And respirations are 16, and her pulse is 64. And are you experiencing any pain? No, your pain's about it too? Okay, good. And do you know if you had an episiotomy? No, you didn't have an episiotomy. Okay, well, I'll check down there anyway, just in case. So now I'm going to check your SpO2. Here we go. And that's at 98%. So I'm going to now listen to you. First, I'm going to listen to your lungs. Take a deep breath, and a deep breath, and a deep breath, and another deep breath. Okay? And then I'm going to listen to your heart in all 5 locations. Pulmonic, or aortic, pulmonic, second pulmonic, tricuspid, and mitral. I'm going to listen for a whole full minute. And then I'm going to roll down the covers so I can listen to your abdomen starting in the right lower quadrant. Okay, and I would listen to those for 15 seconds each. I heard normal active bowel sounds and no murmurs or thrills in her heart rhythm. So then I would just ask her to, can you turn over, or can I lift you up so that I can listen to the back of your lungs? So now I'm going to lift her up and listen to the back of her lungs. Take a deep breath in and out, and in and out, in and out, in and out. Okay? And her lung sounds are normal and clear to auscultation. And then I'm going to palpate my CVA tenderness. I'm going to have a fist like this, and then I'm just going to palpate like this. Do you feel any pain? No? Okay. Do you feel any pain? No? Okay. So no CVA tenderness present. Okay. And I'm going to put the cover back over you. And then so then I'm going to palpate your breasts to see, I know you're breastfeeding. It usually takes 3 to 5 days for the breast to become firm from the milk. So and this is right after birth, so I'm just gonna palpate, and they're nice and soft and supple. And then I'm gonna just take a peek at your nipples, okay? And there's no cracking or sores or swelling or bruising. So that indicates so far the baby is latching on very well. Your nipples aren't bleeding. If it's okay later on, like I said, I'm going to come in and make sure that the baby is latching really well. So next I'm going to assess your uterus, and I already have my gloves on, so I'm going to pull the covers back, and if you could just open your legs a little for me. I'm going to place one hand here on the pubic symphysis to stop the uterus from coming out, and then I'm going to palpate the uterus right below the belly button midline, and make sure the uterus is midline. So the uterus is nice and midline. and it's firm. It's firm. That means it's involuting properly. When is the last time you used the restroom? About an hour ago? Okay. So did you urinate into the cap? Good. So I will assess that, and we'll need you to urinate 2 more times, and we'll check that to make sure that you're urinating the right amount, because if you don't urinate enough, then your uterus will become boggy, and it'll shift up to your right upper quadrant of your abdomen, and then you'll start to bleed a lot. So we want to make sure that we're peeing often, and your bowel sounds are normal active. Do you have the urge to have a bowel movement right now? No. Okay. So next I'm going to assess your lochia. So I noticed that there was no lochia on the bed, but I'm just going to check your perineal pad. Okay, and there's a mild amount of lochia in the perineal pad. It's lochia rubra. It's dark, and there's no odor to it. There's no clots. So if I could just have you roll over onto your side, I'm just going to assess under you to make sure you're not silently bleeding, okay? And this bed pad does not have any blood on it, so your bleeding is being maintained in the perineal pad. When's the last time you changed your perineal pad? An hour ago when you urinated? Okay, good. So next I'm gonna use my pen light, and I'm just gonna assess your perineum area and look at the episiotomy site. And I know you say you didn't have an episiotomy. There's no tearing or anything down there, and it looks like that's in pretty good condition. No tearing, no bleeding from the perineal area. Okay, and then I'm going to get me D10 reflex thingy. Okay, so I'm going to pull the covers down a little bit, and I'm going to be assessing your ankles for edema. And there's no pitting edema down here, so it doesn't look like you're retaining fluids. That's good. And then I'm just going to feel your calves for warmth or tenderness. Does that feel tender to you? No? Okay, and they don't feel warm, so that's a good sign, okay? And then I'm just going to hold your leg up like this, and you just let it dangle. Okay, I'm going to assess your deep tendon reflex, and okay, +2, that's normal. Okay, let's do the other one. Okay, +2, that's normal. And then we're going to assess for clonus, so I'm just going to push your foot up like this. Okay, no clonus. No clonus. Okay, good. Now I'll put the covers back on you. Okay, emotions. How are you feeling about your baby? I noticed that you were like cooing and talking to your baby in a cute little baby voice, and you were holding him. You sound very happy and pleasant, and you seem very enthused about having your baby. Do you have any questions for me about your baby? I know this is your 4th baby, so you seem like you might be a pro at it by now. No? Okay. So when you go home, if you have any feelings that you can't take care of you or your baby, or you can't get out of bed or anything, then you need to call us immediately, because those are signs and symptoms of postpartum depression. Like if you just feel like you don't want to get out of the bed and shower, or you don't want to feed the baby, or you don't want to take care of the baby, you need to call us immediately so that we can help you. Okay? I'm just going to check my assessment card. Okay. So since you're breastfeeding, you need to drink more fluids, about 2,500 milliliters of fluid a day, because a lot of breast milk is made from water, and you have to eat more calories, about 500 more calories a day, because your body is using all of those extra calories to make your breast milk. Okay? And then you can participate in activity as tolerated. If you start to feel dizzy or lightheaded, then definitely sit down, and don't lift anything heavier than your baby for the next 2 weeks. And then as your baby gets heavier, then you'll be able to lift heavier things and do more activity. It takes a year to get pregnant and it takes a year to get unpregnant. So now I'm just going to assess your abdomen for the linea nigra, and that should start to fade away. It's still present right here above the belly button, but it should start to fade away, and I'm noticing that the cloasma has faded away. And you do have some striae or stretch marks here on your abdomen. Those will fade away with time, okay? And drinking plenty of water. So do you have any other questions for me? No? Okay, thank you so much for participating in this postpartum assessment with me. If you have any other questions, you can use your call light within reach. I'm going to lower your bed back down and put your bed rail back up, and you can have mom or your mom give you back the baby, okay? Thank you.